let's just jump right in. If you've ever, say, popped a pimple on your nose or accidentally nicked your upper lip shaving, you probably didn't even give it a second thought, right? Just a minor annoyance. But human anatomy actually holds a fascinating and frankly kind of terrifying secret about this exact spot. In this explainer, we're diving deep into a very specific part of your face that medical textbooks literally issue stark warnings about. It's a place where the microscopic architecture of your blood vessels creates this direct, totally unguarded pathway straight into your cranial cavity. So we really have to ask, could a totally normal, everyday infection on your nose actually reach your brain? Well, we are going to explore the terrifying reality of how a simple blemish could, in extremely rare cases, turn into a fatal intracranial situation. I know, it sounds like the plot of some medical thriller, but it's pure, documented, hard science. By the time we're done here, you are for sure going to look at your own face in the mirror very differently. Okay, to understand this whole medical mystery, we first need to map out our scene of the crime. Clinically, this specific triangle is known as the dangerous area of the face, and we are talking strictly about the lower part of your nose, your upper lip, and just the adjoining part of your cheek right there. So the absolute crucial point to remember is that we aren't talking about your whole face, just this concentrated, triangular zone right smack in the center. But what makes this specific triangle so uniquely hazardous compared to, I don't know, a pimple on your forehead or your chin, well, it all comes down to the plumbing right beneath the surface. Actually, the critical anatomical twist here is all in that plumbing. If we compare your normal, everyday veins to the facial veins in this specific region, there's a massive difference. You see, throughout almost your entire body, your veins are equipped with these little one-way valves. And those valves are absolutely vital because they make sure blood only flows in one direction, back toward your heart, and they completely prevent any backward flow. But here's the kicker. The facial veins draining this dangerous area, they are completely devoid of valves. Zero. None. There is no one-way system here. It's just an open highway where fluid can literally flow in either direction, entirely depending on the pressure applied to it. But a valveless highway isn't really enough to cause a total crisis on its own, right? It needs a motor. It needs a pump to actually move things in the wrong direction. And that is exactly where your own facial muscles come in. We normally just think of the muscles of facial expression as, how we communicate joy, sadness, surprise. But in the context of this dangerous area of the face, those same muscles become unwitting accomplices in a potential medical emergency. Let's break down exactly how this mechanical pump works because it's wild. Because your facial vein rests directly right on top of those muscles of facial expression, there's zero protective buffer. So every single time you smile, frown, speak, or chew your food, those muscles contract and they physically squeeze that valveless facial vein. Now, imagine you have an infection in this area, like a severely infected hair follicle or a picked blemish. This everyday muscular compression can actually squeeze septic emboli, which are basically just infected blood clots, straight into the bloodstream. And because we already know there are no valves to stop them, the pressure pushes that infection in a retrograde or backward direction. You are literally actively pumping the infection backwards with your own smile. So what exactly is the getaway route? How does this infection get from the surface of your cheek directly into your cranial cavity? Well, it takes a 5-step journey on this sort of unstoppable infection express. First up, the infected material enters the superficial facial vein. From there, it gets pushed deeper, right into the deep facial vein. Step 3 takes it into this complex network of veins called the pterygoid venous plexus. Step 4 is the really critical bridge, the emissary vein. This vein is essentially a direct passageway right through the skull bone itself. And finally, step 5, the infected clot arrives at its final, fatal destination inside your skull. And that step 5 brings us to the cavernous sinus. This is a major venous sinus located deep inside your skull. Picture a large, blood-filled space situated dangerously, incredibly close to the base of your brain. And what makes this specific area so hypersensitive is that several vital cranial nerves, plus the internal carotid artery, pass directly through it or right alongside it. It's honestly one of the most critical, highly trafficked anatomical intersections in the entire human body. Once that infection actually breaches the cavernous sinus, the situation escalates insanely fast. We go from a localized skin issue to a life-threatening systemic crisis. The arrival of those septic emboli causes the blood within the cavernous sinus to clot, a terrifying condition known as cavernous sinus thrombosis. This massive infected blood clot basically blocks drainage right from the brain. And worse, the infection can easily spread to the protective membrane surrounding your
your brain, leading to fatal meningitis. The neurological fallout from a thrombosed cavernous sinus is just absolutely devastating, because those vital cranial nerves run straight through this infected, highly swollen sinus. They become severely compromised. Patients experience this extreme, blinding pain in their eye and forehead just because the ophthalmic nerve is being severely compressed. On top of that, the third, fourth, and sixth cranial nerves, the ones that literally control your eye movements, can become completely paralyzed. This condition is called ophthalmoplegia, which means the patient totally loses the ability to move their eyes.
And the physical signs on the outside of the face, they are just as severe and dramatic as the internal neurological damage. Because that cavernous sinus is completely blocked by the infected clot, normal blood flow coming away from the eyes just can't drain properly. It backs up. This backed up blood flow causes massive congestion in the ophthalmic veins. Visually, this presents as marked edema, just really severe, aggressive swelling of the eyelids. But even more frightening is exophthalmos. This is a highly noticeable, incredibly dangerous bulging of the eyes directly outward from their sockets, just all due to that immense pressure building up right behind them.
So this is exactly why medical professionals take infections in this specific region incredibly seriously. Doctors know that right beneath the skin of your upper lip and lower nose lies this totally valveless plumbing system. What might just look like a routine boil or a simple infected cut to you or me is instantly recognized by a clinician as a potential trigger for cavernous sinus thrombosis. Extreme care and very often aggressive antibiotic treatment is absolutely critical here to prevent that infection from ever making that backward journey into the skull.
It really is this incredibly unique combination of structural vulnerability, the lack of those venous valves, paired with the mechanical, everyday action of our own facial expressions that creates such a profound risk. This perfect storm is exactly why anatomy textbooks dedicate stark, specific warnings to this area, officially dubbing it the dangerous area of the face. You see, anatomy isn't just about memorizing names. It's about understanding exactly how these structures interact and the severe, real-world consequences when things go wrong in highly sensitive zones.
So, now that you know exactly what is lying in wait beneath the skin of your nose and upper lip, it really leaves us with one final, pretty urgent question about your own health habits. We've traced the entire path from a simple surface infection pumped backward by your own smile through valveless veins straight into the cavernous sinus of your skull. Knowing all about this anatomical highway to the brain, how will you treat your next facial blemish in the dangerous area of the face? I really hope this explainer has given you a newfound respect for your own anatomy. Stay curious, keep learning, and please be super careful with that little triangle on your face.